My particular areas of focus are facial rejuvenation and body contouring, particularly specialist abdominoplasty surgery, combining traditional tummy tucks with liposuction at the same time, which isn't or hasn't normally been done in the past. When I see a patient, they generally fall into two categories. It's either a lady who is post-pregnancy and has had stretched the tummy muscles, stretched the abdominal wall, plus minus a cesarean section scar, which can cause some tethering and an overhang. Or the patients have lost massive weight, and obviously this can be either a man or a woman. Usually they're seeking to improve the appearance of their tummy. Often they find it quite distressing. They can't find clothes that fit. When they do wear clothes, it causes unsightly bulges. And they're looking to somehow manage to change how they're going to change how their appearance is, but also how they're going to become more comfortable in their own skin, as it were, following either the weight loss or trying to get their pre-pregnancy body back. The first bit of any treatment program or plan is actually hearing what the patient's wants and desires are and what their worries are. And then basically, you listen to all of those, check out if there are any medical reasons that they're not going to be an ideal candidate for surgery or might limit what you can do surgically, and then actually have a look at what their problem is. And then putting all that together, coming up with a plan tailored for them to say, look, this is what we can likely achieve for you, this is what I can't achieve for you, this is where we can get improvements, and perhaps these things aren't achievable, and then finding out if that is going to be good enough for them, or if perhaps, it doesn't meet what they were hoping for. The advice is usually, well, in that case, don't have the surgery, because if there's nothing worse than being disappointed with the outcome. On the day of surgery, typically the patient will come into hospital, usually an early start, I'm afraid, and then I will see them on the ward. We'll go through the consent process again, and usually I would like to think that they've been thoroughly briefed before they actually get as far as needing to sign a consent form. For me, it usually starts in the consultation. I'll go through all the risks and complications related to the procedure, plus the recovery process. Coming out of surgery, obviously, depending on whether you've had a local anaesthetic or a general anaesthetic, it's a slightly different experience. If it's a local, well, we'll have most probably chatted all the way through it anyway, so they know exactly what's going on, and because they haven't had a general anaesthetic, they're up and ready to go. If you've had a general anaesthetic, or perhaps a little bit of sedation, you'll obviously be coming round and suddenly become aware that you're back in the recovery room. I always visit my patients immediately following the surgery, so I have a little chat, tell them how it's all gone, and then basically just check on the other medical bits. The patients can expect to sort of probably have a degree of discomfort, some pain, I guess, because that's surgery. But we put local anaesthetic in to try and minimise that. They'll be looked after by the recovery staff until they're awake. And that usually takes about half an hour or so. And then after that, they're taken back up to the ward, and we'll try and get some food inside them, a bit of something to eat, get their blood sugar levels back up. They're free to have visitors. I'll pop up and see them on the ward. And then, depending on what procedure they've had, it's either home the next morning or sometimes a 2 or 3 night stay, but that depends on the extent of the surgery. I will see the patient every day they're in hospital. And then on the day of discharge, they will be given medication, pain control, any antibiotics as appropriate, and information leaflets, as well as sort of a proper briefing before they go as to what to expect. On top of that at Circle, what we've got is a great service. We have our own cosmetic nurse specialist who provides a personal tailored care for every single patient, which is second to none. So they have direct contact with her the whole time, and she's up to the ward on a regular basis just to make sure they're okay and they know what the circumstances are.